So, a couple of weeks ago, the original Candace Kelly was having a discussion about men's who had hit their expiration dates. And a little while back, I was discussing the risks that come along with having kids by an older pappy. My pages weren't as popping back then when I had that discussion, so I decided that we needed to talk about it today. The risk to babies of older fathers. And I got a good chuckle out of the thumbnail that they used for this, looking like a grandpappy holding his grandchild. So I got a chuckle out of that. But let's get into this. Most women know that reproductive risks to themselves and their babies rise as they get older, but few men realize that their advancing age may also confer a risk. We talk a lot about the women. Let's talk about the daddies. Let's talk about the pappies that are having babies as they get older. People are becoming parents at ever-increasing ages, a trend that can have implications for the health of the pregnancy and the babies and the women who birth them. But while most women know that reproductive risks to themselves and their babies rise as they get older, few men past 40 realize that advancing years may also confer a risk. The age at which a couple start families has been rising steadily for the last 4 decades, as more couples marry later and delay having children until they've completed their education and are secure in their career. Since the 70s, the percentage of births to fathers aged 40 or older in this country has doubled, and by 2015, they accounted for 9% of the births. So, for so many years, it was assumed that the advancing age mattered only for women. This is wrong. A recent study of more than 40 million births, not just a small study, this was 40 million births in the United States, revealed potentially harmful effects of advanced paternal aging on the babies. Some of the risks: premature births, low birth rate, low APGAR score, and risk of seizures, as well as the mother's chances for developing gestational diabetes. Having expired sperm could cause gestational diabetes, and sometimes women continue to have diabetes even after they deliver the baby. The research says that more than 12% of births to fathers aged 45 or older with adverse outcomes might have been prevented were the fathers younger. So keep that in mind. The risks associated with older fathers go beyond those obvious at birth. An earlier review of studies published by Dr. Eisenberg and Dr. Simon Conti, clinical assistant professor of urology, linked paternal aging to increased risk of babies born with congenital diseases like dwarfism and developing psychiatric disorders like schizophrenia and bipolar disorder and developmental ones like autism. For example, a study of nearly 400,000 men and women born in Israel, that's 400,000, born in Israel in the 80s, found that among fathers over 40, the risk of having a child with autism increased nearly sixfold. Other studies found that risk of childhood leukemia, breast and prostate cancers were elevated for offspring with older daddies. This is a long article. I want to talk about this part right here. There are a number of possible reasons older fathers may impart health risks to unborn babies. Unlike women who are born with all the eggs they will ever produce, after puberty, men continuously produce new sperm. Mutations can occur and accumulate in the DNA of sperm-forming cells, and environmental exposures can change the genes in sperms themselves. Some of those changes can affect growth factors for both the placenta and the embryo. There needs to be a greater awareness of the men's responsibility to reproductive health, how they are living. And these men in this country are having a hard time getting to 60. These men are having all kind of diseases and health issues, but they spend so much time focused on women and mothers that they are not talking about what's going on themselves. These men that have these breasts, these men that have these postpartum bellies, and they don't have any pregnancy to show for it, need to be talked about because their sperm is impacted. Yes, and so are the babies, and so are the mothers. Y'all jump in the comments. Y'all talk about this because we need to talk about it just as much as they talk about women hitting the wall and running out of time and all that they talk about with us. Like, comment, share. Tell me what you think.